There are a number of ways that HealthOne can facilitate the management of chronic diseases through the analysis function. And the first of these that we'd like to demonstrate today, for those of you who aren't familiar with it, is the use of the analysis function to flag patients with a particular chronic disease. And hypertension is a great example of how this can be useful. So we go to the database analysis function, also known as Query Plus, and we're going to create a new analysis that will be called hypertension flag. And the purpose of this analysis is to find patients with hypertension and to create a disease flag for those patients. So it's going to apply to all ages, all sexes, active patients of the practice. We're going to exclude or test patients because we don't want them returned. And it's going to be confined to the medical chapter as a clinical analysis and to speed things up. We're going to look at patients who have either assessment containing the word hypertension or perhaps some variation, a local code used for recording high blood pressure, because people vary within a practice and between practice and how they do this. Also, we'll be looking under the medical history item in the basic medical information for the same codes. So this is an analysis. It's going to be called hypertension flag. It's going to look in the medical chapter for any basic medical information containing medical history or items called assessment in the chart with any of these strings. And we're going to save it by pressing OK. We're now going to find it or just click execute the already selected analysis. And as you can see, it has now returned 5 patients, all of whom had the hypertension recorded in the medical history rather than in contact under assessment. I want to create a disease flag for these patients so they're more readily identifiable as having hypertension. So I'm going to select all of them and I'm going to flag the result. And I have to look for a disease flag. We already have a disease flag called hypertension. If we didn't, I would have to create one by finding the term that I want on the left pane and dragging it over to here. But it's already there, so I don't need to do that. I merely need to tell HealthOne to put the flag hypertension on all of those patients. During future analyses, for example, I used to create a new analysis. When I want to look for hypertensive patients now, all I have to do is create, fill this field with the word hypertension, and a new analysis will immediately find those patients without any more detailed search criteria. So my 5 patients are found immediately, and this frees up these spaces in order to do sub-category analysis of my hypertensive patients. But a more immediate use may be to find these patients more easily or to make them more visible within the patient selector. And to do that, I need to configure the patient selector by including a column for this flag, which I have done. And now when I'm looking for patients with hypertension, I just have to select hypertension in the header of that column, and all such patients are identified. So very rapidly, without doing a database analysis, I can see which of my patients and how many of them, in this case, on my small database, 5 of them who have hypertension. For example, if I wanted to know which of my female patients with hypertension, I could sub-select from that cohort the female patients, and so on. So that's how database analysis and the disease flag function can assist us in managing our hypertensive patients.